So there is some evidence mounting that is actually persuading some doctors to move away from using ventilators for patients. Reason being is they are finding that there is an extraordinarily high deletion rate. And I'm trying to be very careful with my words because I want this video to be able to be spread. There's a very high deletion rate among individuals who get put on that ventilator. In fact, it sits at about 76% when you get put on. When you get to the point where you get put on the ventilator, there's a 76% deletion rate. So some doctors are moving away from it. And let's read this. This is from the Associated Press. I found it through my local KRQE news site. As health officials around the world push to get more ventilators to treat patients, some doctors are moving away from using the breathing machines when they can. The reason? Some hospitals have reported unusually high death rates for coronavirus patients. Frick, I said the word. On ventilators, and some doctors worry that machines could be harming certain patients. So we got to find out what the criteria is. We've got to figure out if there's any kind of commonality, if there's any kind of symptoms. So that way we can figure out which patients are good candidates for ventilators and which ones are not. The evolving treatments highlight the fact that doctors are still learning the best way to manage this thing that came out only a few months ago. They are relying on an anecdotal real-time data amid a crush of patients and shortage of basic supplies. And that's really one of the big fights is that it's just unknown. And as data goes on, we're using these models that computers are putting out based upon information that we have. But as new information goes in, the models are changing. So then they have to go off the model differently because the model is changing with new information. I hope that makes sense. Mechanical ventilators push oxygen into patients whose lungs are failing. Using the machines involves sedating a patient and sticking a tube into the throat. Deletions in such sick patients are common, no matter the reason they need breathing help. Generally speaking, 40 to 50% of patients with severe respiratory distress die while on ventilators, experts say. But 80%, and I heard it as 74 on a national level, 74 or 75% on a national level, but pretty close to their 80% as well. But 80% or more of the coronavirus, screw it, we're just going to say it, 80% or more of the coronavirus patients placed on medicine machines in New York City have died, city officials say. Higher than normal death rates have also been reported elsewhere in the United States, says Dr. Albert Rizzo, the American Lung Association chief medical officer. And I heard it at 74%. They're getting it at 80%. Maybe they have access to other resources. I did pretty extensive research on it, but similar reports have emerged from China and the United Kingdom. One UK report put the figure at 66%. A very small study in Wuhan, the Chinese city where the disease first emerged, said 86% died. The reason is not clear, and it's something that we should definitely be looking into and investigating. Anytime that we have an opportunity to save someone's life, we should jump on that. That's something that should be done. It may have to do with what kind of shape the patients were in before they were infected, or it could be related to how sick they have become by the time they are put on the machines, some experts say. Perhaps it's a matter of before they get on the machine, they bring down the sickness and maybe apply the machine at an earlier time, maybe delay the machine longer, see if symptoms can come down by other means. I mean, obviously I don't know the answer. I'm just shooting in the dark because this is something that affects all of us. What if it happens to you? What if you get to that point? You would like the doctors to be as informed as possible to save your life. I guarantee you that. But some health professionals have wondered whether ventilators might actually make matters worse in certain patients, perhaps by igniting or worsening a harmful immune system reaction, which it could be sometimes in cases like this. In fact, the reason that people get this bad is it's literally your body fighting itself. The virus gets in there, replicates inside the cell, tells the cell to self-replicate the virus. The cell, your own cell, replicates the virus. And then the virus sends the cell a signal to self-destruct. The cell self-destructs and the virus moves on. Your body's trying to fight it, but the cells that your body's sending to fight the virus end up getting infected as well. So then your body fights itself. We know that mechanical ventilation is not benign, said Dr. Eddie Fan, an expert on respiratory treatment at Toronto General Hospital. One of the most important findings in the last few decades is that medical ventilation can worsen lung injury, so we have to be careful how we use it. And yes, we do. And you gotta wonder, all these ventilators, thousands and thousands and thousands of ventilators being used now, they're going to cause long-term health issues. Even in young patients, if they get to the point where they get put on a ventilator and they survive, it is going to cause issues further down the road. I mean, most doctors agree with that. The dangers can be eased by limiting the amount of pressure and the size of breaths delivered by the machine, Fan said. Like a balloon, you don't want to overtax the lungs. But some doctors say they're trying to keep patients off ventilators as long as possible and turning to other techniques instead. Only a few weeks ago in New York City, coronavirus patients who came in quite sick were routinely placed on ventilators to keep them breathing, said Dr. Joseph Habouche, an emergency medicine doctor who works in Manhattan hospitals. But increasingly, physicians are trying other measures first. One is having patients lie in different positions. I've seen one where they lie on their stomachs to ease the breathing, including on their stomachs, to allow different parts of the lungs to aerate better. Another is giving patients more oxygen through nose tubes or other devices. Some doctors are experimenting with adding nitrous oxide to the mix to help improve blood flow and oxygen to the least damaged parts of the lungs. So really, it just seems like we are in the wild, wild west of medicine here when it comes to this thing, and we've got multiple different routes coming out, and let's hope that one of them comes out as the front runner and is successful. If we're able to make them better without intubating them, they are more likely to have a better outcome, we think, Abouche said. He said those decisions are separate from worries that there are not enough ventilators available, but that is a concern as well, Abouche added. What are you going to do, man? You're damned if you do, and you're damned if you don't. You're damned because you don't have the supplies to begin with anyways. Maybe we should just go to the woods and start practicing trying to get different kinds of moss and bark and apply it to their skin and see if that heals them. I mean, god dang, here we are. This whole thing is just so bizarre. The richest country in the world. And I am caring for an elderly father who is absolutely in the highest risk group for this thing. And, I'm trying to get gloves. And all they have are these little packs of 6. So I go to get 8 gloves. So I go to get 4, which would be 32 gloves. And they would only let me buy 3. It's 8 gloves for crying out loud. It's 35 miles out there. And see, now you're forcing a situation where I've got to drive out there. Those gloves are not going to last as long as another extra box. So then I have to drive in and use more supply when supply comes in, thereby making the supply. I mean, the whole thing is just bizarre. We're rationing food, the richest nation in the world, and we're rationing shit. We're rationing people's health care. We're rationing who gets health care. The whole thing is just crazy. There are widespread reports that coronavirus patients tend to be on ventilators much longer than other kinds of patients, said Dr. William Schaffner, an infectious disease expert at Vanderbilt University. Experts say that patients with bacterial pneumonia, for example, may be on a ventilator for no more than a day or two. But it's been common for coronavirus patients to have been on a ventilator 7 days, 10 days, 15 days, and they're passing away, said New York Governor Andrew Cuomo when asked about ventilator death rates during a news briefing on Wednesday. I feel their pain, man. I just, man, God, almost feels like a losing battle, I know, to the healthcare workers. I know people in the healthcare field, and yeah, I know it feels like a losing battle. I know it feels like there's no end at the tunnel, but we appreciate everything you do, and we appreciate the fact that you're dealing with less than ideal situations. And everybody's demanding the same thing all at the same time, which is exacerbating the situation. That's one reason for worries that ventilators could grow in short supply. Experts worry that as cases mount, doctors will be forced to make terrible decisions about who lives and who dies because they won't have enough machines for every patient who needs one. New York State Health Commissioner Dr. Howard Zucker said Wednesday that officials are looking into other possible therapies that can be given earlier, but added that it's all experimental. Not exactly what you want to hear when it comes to our healthcare, is it? That it's all experimental. The new virus is a member of the coronavirus family that can cause colds as well as more serious illnesses. Health officials say it spreads mainly from droplets when an infected person coughs or sneezes. There's no proven drug treatment or vaccine against it. Experts think most people who are infected suffer nothing worse than unpleasant but mild illnesses that may include fever and coughing. But about 20%, many of them older adults or people weakened by chronic conditions or other pre-existing conditions, can grow much sicker. They can have trouble breathing and suffer chest pain. The lungs can become inflamed, causing a dangerous condition called acute respiratory distress syndrome. An estimated 3 to 4% may need ventilators. Out of that 3 to 4% is when you hit the 80%. My father being in the absolute danger zone with pre-existing conditions with his age, if he does get infected with that 80%, that makes it a very serious, very real thing on my end. Anyways, the ventilator is not therapeutic. It is a supportive measure while we wait for the patient's body to recover, said Dr. Alvarez, a lung specialist with the University of Miami Health System in Florida, who is a leader in the effort to use nitric oxide to keep patients off ventilators for as long as possible. And I agree. It is a very invasive procedure. It's not something that should be taken lightly. We're going to skip down here. Shemtob. Let's see. Zachary Shemtob. Let's see here. Zachary Shemtob said he was absolutely terrified when he was told his 44-year-old husband, David, needed to be put on a ventilator at New York University Langone last month after becoming infected with the virus. Needing to be ventilated might mean never getting off the ventilator, he said. Okay, so Shemtob is the husband, and his husband was in the hospital needing a ventilator and scared. Gotcha. Okay. Shemtob said the hospital did not give any percentages on survival, but he got the impression it was essentially a coin flip. He looked up the rates only after his husband was breathing on his own 6 days later. A coin flip was generous, it seems, he said. Yes, at 80%, a coin flip, at least maybe the odds are a little bit more in your favor. But they are definitely not forever in your favor. But Shemtob notes cases vary. His husband is relatively young. Age makes a huge difference. David is living proof that they can really save lives and how incredibly important they are, Shemtob said. A lot of reading, sorry. Yeah. What do we do, man? Short supply, then the supply you need could be harming people, but then you need it to try to help save lives. But then 80% when they go on there, it's just, and you don't like hearing that it's a brand new frontier, that we're basically in the wild, wild west of medicine when it comes to this thing, because doctors are experimenting. But that's where we're at with it. I love you guys. I'll keep you informed to the best of my ability. And I will see you guys in the next one.